Welcome back to Cancer Buzz TV. I'm your host, Summer Johnson. On this episode, we examine the financial barriers of cancer diagnostics and how to mitigate the challenges of high testing costs, coverage complexities, and heavy administrative overhead. We also discuss ways to reduce these financial hurdles and increase access to new treatment options. Our guests today are Dr. Jan Nowak, Clinical Chief of Molecular Pathology at Roswell Park Comprehensive Cancer Center in Buffalo, New York. Alti Rahman, Practice Administrator for Oncology Consultants in Houston, Texas. And Jordan Karwedsky, Financial Counselor at Green Bay Oncology in Green Bay, Wisconsin. Thank you all for joining me today. Dr. Nowak, we'll start with you. What are the financial barriers that patients face when they're getting screened?
Well, as a laboratory medical director, I have responsibility for ensuring that a clinician is ordering the correct test for his decision making, and that the correct specimen is obtained and that the specimen is submitted to the appropriate CLIA certified laboratory. In most cases, the requested test will be recognized by a specific CPT code, and coverage limitations are assigned to that specific code by the various payer policies. It's only when a requested test does not have a specific assigned CPT code or the coverage policy does not recognize a particular use of that test that a patient may be left with payment responsibility. If there is a valid clinical indication for use of the test, supported by evidence-based guidelines and peer-reviewed literature, then a specific CPT code can be requested and payer policy restrictions can be addressed. In short, ordering the correct biomarker test for the patient's clinical situation will preclude financial burdens that befall patients. Misunderstanding the use of biomarker testing and misordering will or can result in payer claim rejections.
Mr. Rahman, how can care teams create equitable access to screening?
The cancer screening process is a community-based approach. It's something that doesn't just belong to the healthcare provider or health system realm. It is an approach taken to educate various communities on the importance of screening. And that starts off with not just finding the doctor, but as a community ages, what types of social determinants of health, as we know, equitable access to care really can be driven a lot by the zip code that you live in. And the approach has to be a community-based approach where the health providers, as part of a health system or a health provider community, engages with that community to discuss the importance of screening. Now, screening is one part of the healthcare journey, and how that relates downstream to if you have a cancer diagnosis goes down to how that information is translated from a diagnosis to a treatment decision. And this is where precision medicine has a lot of promise, because the idea of precision medicine is to be able to take all of those critical data points in a patient's health journey, both behavioral, social, and clinical, and to be able to integrate it into a prognostic indicator of where you could land in your cancer journey. And all of those factors are important. It's not just about precision medicine and tying together clinical factors, but also social and behavioral aspects as well.
Ms. Karwedsky, what can care teams do to alleviate financial burdens on underrepresented communities?
Well, depending on what they have for coverage and the time of year, if it's open enrollment for Medicare or the marketplace, we can help kind of direct them in an avenue to get better coverage. If there's somebody who doesn't have insurance, do they qualify for Medicaid? So we can have them screen for Medicaid if they, if it looks like they're going to qualify, get that application going. Depending on, the particular lab work that's needed, maybe the reference lab that's doing the lab work has a financial assistance program. If it's something that's being done at our facility, there's financial assistance through the facility also if they would meet the financial requirements of it.
Mr. Rahman, what has guideline concordant screening and testing done to administrative costs?
When we think about guideline concordant screening and testing and look at how we deploy procedures in the practice in terms of making sure that our patients are getting the right types of screening and the right types of testing, we have to be mindful that we're in a world right now that is predominantly fee for service, that is looking at testing different methodologies of moving away from a quantity-based healthcare system to a quality-based healthcare system. In a quantity-based system, the payment methodologies are tied with clinical services, how much you do. The preventative or reactive factors are in the realm of the quality-based reimbursement methodology. So practices like ours that are looking at participating in a value-based care relationship with a payer, those are the aspects that we look at in a successful value-based care relationship, where we move to a payment methodology that isn't tied to how many services we do, but what's the quality of those services. That's where concordant screening and testing becomes really important for us, because that's what's going to determine at least our economic success in a payment model that's looking at tying quality outcomes. And my philosophy is that if you're doing the right thing from a quality perspective, the economics follow naturally. So we've made a concerted effort to keep moving the needle away from fee for service and look at what a payer is thinking, or not more thinking, actually deployed from a screening aspect and testing aspect as part of its population approach.
Finally, Dr. Nowak, what do care teams need to understand in order to clarify coverage for cancer diagnostics?
So the AMA CPT editorial panel, with the assistance of multiple professional societies, endeavors to maintain a set of CPT codes that recognize the most recent advances in biomarkers and testing technologies. So the professional societies cooperate in developing evidence-based guidelines for the use of these biomarkers and tests, which in turn provide the payers with data to establish valid coverage policies. So understanding how coverage decisions and policies are made will help identify gaps in those policies, which can then be addressed. Now, as with any administrative or bureaucratic process, there will be time delays occasionally before valid codes and policies can be established. However, understanding that process also enables productive appeals to payment denials when they occur.
Thank you for the discussion today, Dr. Nowak, Mr. Rahman, and Ms. Karwedsky. You can visit the show notes for resources and more information on managing the costs of cancer diagnostics. On behalf of all of us here at Cancer Buzz TV, thank you for watching. I'm Summer Johnson.